Carrie. I'm going to be your student nurse today. How are you doing?
Great.
Can I ask your name and date of birth, please?
Michael Chase, on April 23rd, 1997.
And do you have any allergies?
No.
Okay, let me just check your wristband. Okay. I will put in the chart, I will record in the chart that the patient states that they have no allergies. I'm just going to draw the curtain for privacy, and we're going to do a quick head-to-toe exam today. I'm going to start by asking you a couple of questions. Do you know where we're at?
The hospital.
Do you know why we're here?
Just a checkup.
And do you know what today's date is?
April 30th, 2020.
Okay. And do you know what time it is?
3 o'clock.
And who is the President of the United States currently?
President Trump.
Okay, I'm just going to wash my hands and put my gloves on and we'll get started. I'm washing my hands. My patient is alert and oriented ×4. He's conscious and awake. He was able to shake my hand when I got in the room. His mood is pleasant. His affect is calm. I don't see any signs of distress or any obvious physical deformities. His stature is erect and proportionate with his weight. And his stated age is congruent with his physical appearance. His hygiene looks good, his hair looks clean, his skin looks clean, and his nails look clean as well. Okay, I'm just going to ask a couple of more questions. Do you have any pain today?
No.
So on a scale from 0 being no pain to 10 being the worst pain you've ever felt, how would you rate your pain?
0.
Okay, I'm just going to start with some vital signs here with your pulse. Okay, your pulse was 72 and your respirations were 12. I would continue to take vital signs if I had the proper equipment with me. Alright, and now I'm just going to start with your head and neck. Some more questions. Have you had any headaches or pain?
No.
Have you had any nasal occlusion, like your nose is stuffy?
No.
Have you had any drainage from your eyes, nose, ears, or throat?
No.
And have you had any changes in your vision? Any changes in hearing?
No.
Okay. Just going to start by taking a look at you. I see that your hair is evenly distributed across your scalp, your eyebrows, your upper lip, and on your lower chin. I see you have some moles. Your skin is uniform in color, intact. I don't see any cuts or bruises. And your facial features appear symmetrical. I see you have 2 eyes and 2 ears. I'm just going to start by taking a look at your eyes here. Okay, your palpebral fissures are even, your sclera is white, and could you pull your eyes down for me? And your conjunctiva is pink and moist, thank you. Alright, now I'm just going to shine a light in your eye. If you could look straight forward for me. Okay, and now if you could follow the tip of my pen, please, with your pupils, your eyes. Okay. So my patient's pupils were equal, round, and reactive to light directly and consensually. His eyes accommodated with distance. When my object got closer to his face, his pupils constricted and converged, and when my object got farther away, they dilated. I don't see any drainage or redness in your eyes, so we'll take a look at your ears here. I don't see any signs of skin breakdown or redness or irritation or drainage. And it appears that your nose is symmetrical in your face. Would you mind tilting your head back? I'm just going to take a look inside. I see that you don't have any cuts or bleeding from your nose. It doesn't appear that your septum is deviated, and your nostrils are symmetrical. Your mouth, your lips, and your lips are moist and pink. They don't look dry or cracked. Could you open your mouth for me, please? I see you have all your teeth. None are broken and they look white. Your mucous membranes are pink and moist. Could you say ah for me? Did you have your tonsils removed? Okay, so your tonsils are 0. They're removed. And could you put your tongue through your mouth? And I see you have saliva under your tongue, so no signs of dehydration there. All right, now I'm just going to feel for your lymph nodes here. Okay, your lymph nodes are not palpable, they're soft and mobile. Now I'm just going to feel for your carotid pulse. Okay, your carotid pulse strength is 2+ and regular rhythm. Now I'm just going to move to your upper extremities. Have you had any pain or weakness in your arms? Have you had any changes in sensation? And do you feel like you have full range of motion with your arms?
Yeah.
Okay, so looking at them, I see that the skin is uniform in color. Hair distribution is even. I don't see any cuts or bruises or lesions. And I'm just going to feel here. Okay. Your muscles are smooth and uniform bilaterally, and your skeletal structures are intact and smooth bilaterally as well. So can I have you put your arms like this for me? Thank you. I'm just going to feel for your brachial pulses here. Brachial pulses are a 2+ in strength, regular rhythm, and symmetrical. Now your radial pulses. Radial pulses are a 2+ in strength, regular rhythm, and symmetrical. Now could you flip them over for me? Thank you. And I see your capillary refill is less than 3 seconds. Could you squeeze my fingers, please? Now pull them. Now push on my hands. Okay, your strength is a 4+. All right, now moving on to your chest. Have you had any chest pain or difficulty breathing? Have you had any cough with sputum production? Have you had any feelings like your heart is racing?
No.
And have you had any wheezing or snoring?
No.
Okay. Just looking here, I don't see any chest hair. No lesions, cuts, bruises. Your skin is intact and smooth, uniform in color, and your chest is rising and falling symmetrically. I see even and unlabored breathing. Okay, so now I'm just going to pinch your skin here. All right, and your skin trigger is good. I don't see any tinting. So now I'm just going to listen to your apical pulse at Erb's point, 3rd intercostal space, left of the sternal border for 1 minute. Your apical pulse was 74, regular rhythm. S1 and S2 sounds were heard, and I didn't hear any adventitious sounds. Now I'm going to listen to your lung sounds. Each time that you feel my stethoscope on your skin, if you could just take a deep breath in and out for me. Okay, bronchovesicular sounds are clear bilaterally with no adventitious sounds. Anterior vesicular sounds were clear bilaterally with no adventitious sounds. Posterior bronchovesicular sounds were clear bilaterally with no adventitious sounds. posterior vesicular sounds were heard clearly bilaterally with no adventitious sounds. And lateral lung sounds were heard clearly with bilaterally with no adventitious sounds. Okay, now I'm just going to move to your abdominal area. Have you had any frequency or urgency to urinate lately? Have you had any pain urinating? When was your last bowel movement?
About 5 minutes ago.
Okay. And have you had any constipation or diarrhea lately?
No.
How's your appetite been?
Great.
Okay. And have you had any abdominal pain at all?
No.
Okay. If you wouldn't mind laying flat for me, I'm just going to take a look at your stomach. Okay. I see that your skin is smooth and intact, uniform in color. Don't see any lesions. I see that your umbilicus is midline. I see that your contour is flat. I don't see any pulsations or waves of peristalsis. So now I'm just going to listen to your abdominal sounds, starting with the right lower quadrant. Right upper quadrant. Left upper quadrant. And left lower quadrant. Okay. Bowel sounds were heard in all 4 quadrants and normoactive. And now I'm just going to palpate your stomach. Let me know if you have any pain or tenderness when I do this. Did you have any pain or tenderness?
No.
Okay, I didn't feel any masses. You can sit up if you'd like. Just going to ask you about your lower extremities now. Have you had any pain or weakness in your legs?
No.
Have you had any limits in range of motion with your legs? Okay. And have you had any changes in sensation with your legs? Okay. Just looking at them here, I see that there is hair bilaterally and it is evenly distributed on both legs. I see that your skin color is uniform. Looks a little bit darker where you have sun exposed areas. I don't see any venous patterns. I don't see any cuts or bruises or lesions like that. Now I'm just going to feel for your musculoskeletal structures here. Okay, so your muscles are smooth and uniform bilaterally, and your skeletal structures are intact and smooth bilaterally as well. Now I'm just going to feel for some edema. So I didn't feel any edema or see any edema, so I'll grade your edema as 0. And now I'm going to check your capillary refill. Capillary refill is less than 3 seconds. And now if you wouldn't mind pushing up with your feet, now pushing down. Okay, I grade your strength a 4+. All right, I think that's all I have for you. Do you have any questions or need anything right now?
No.
Okay. I'm going to raise the side rails for safety, lower your bed to the lowest position, and here's your call light. Okay, I didn't see any abnormal findings, and you seem well to me.
Thank you.
Taking off my gloves, and I'm washing my hands. Head to toe, my patient's skin was uniform, intact, uniform in color, intact. I didn't see any lesions or bruises. His hair was evenly distributed across his head, eyebrows, upper lip, and a little bit on his chin. It was evenly distributed bilaterally on his arms and legs. His capillary refill was good. And then his musculoskeletal structures were all symmetrical and intact, head to toe. And neurologically, he was alert and oriented ×4. He was able to follow all of my commands, sit up and shake my hand. His mood was pleasant and his affect was calm. I didn't see any signs of obvious physical deformities, and I didn't see any signs of distress.